What an incredible study. This study will really help you develop an appreciation for the impact the microbiome of the mouth can have on, at least in this case, the outcome in reference to healthy pregnancies. Now, keep in mind, this was a randomized study, and all we're looking at is chewing 2 pieces of gum per day over the length of a pregnancy, and yet yield an incredible outcome, not just in the healthy pregnancy, but basically the birth weight of the baby itself. To proceed as follows. Chewing xylitol gum linked to decrease in preterm birth. Preterm. Could the incidence of preterm births be lowered by chewing gum? New research suggests yes. I want you to keep in mind, this was a randomized study on top of that. Results from a study in Malawi showed that chewing gum containing xylitol, a naturally occurring alcohol sugar, was associated with a 24% reduction in preterm birth. Researchers found that a group of pregnant individuals randomized to receive chewing gum also saw a 30% drop in low birth weight babies. That is amazing. So you're looking at just the microbiome of the mouth having an impact on another human being. To proceed, when compared with the control group which had not received the xylitol gum. Quote, it surprised us that such a simple intervention could have such a dramatic effect. And that is an understatement. I want to show you basically the full study itself, just to basically validate and reinforce that this was a randomized study involving quite a few individuals. The study followed 2 randomly selected groups of patients over 3 years in Malawi with over 10,000 participants. A total of 4,549 patient participants received the xylitol chewing gum intervention, while 5,520, the control group, received traditional counseling and medication. Almost seems criminal that they didn't receive the xylitol gum, but again, this was a study. The study was conducted from May 2015 to October 2018. The data analysis and follow-up was completed on October 2021. Previous research has shown that during pregnancy, periodontal disease, also known as gum disease, is associated with a 2 to 3-fold increase in the risk for preterm birth and low birth weight delivery. Now, a couple of highlights. Quoting, here report that xylitol used during pregnancy in an at-risk population specifically lessened maternal periodontal disease with habitual use, which was temporarily accompanied by a reduction in the risk of delivering preterm and low birth weight neonates. Highlight number 2. The full retail, just to give you an idea of the perspective of how low cost this intervention is overall. Price per piece ranges from basically 5 cents to 22 cents. The price for a total of 37 weeks of twice daily 2 pieces of therapeutic chewing gum use would range from $23.96 to $114, we'll just say, per person for the duration of the last menstrual period to 37 weeks, reaching term. A retail cost, the estimated and average US dollar cost per prevention would be less than a single day in newborn intensive care, which a single day they're saying would average about $1,163 compared to as low as $24 per se, rounding, over the course of a pregnancy. Pretty substantial, significant savings just by chewing a couple of pieces of gum per day. And now the methodology. Participants at the intervention sites were provided xylitol-containing chewing gum, there's your brands, at each study visit from basically CHW at the health centers. Participants were instructed to chew 2 pieces of gum, which has 1 gram of xylitol per piece, for 10 minutes after the morning and evening meals, and have gum be the last thing consumed in the evening. Now, the researcher Valentine. Malawi trial, the prevention, development, delay in xylitol study. It followed 1,000 children born during the initial trial to study neurodevelopmental outcomes between the age of 4 and 8 years of age. All right, to reiterate, what we're looking at here is the children that were born to the mothers who consumed the xylitol, chewed the xylitol gum. They want to even just follow up on the children as far as checking vision, hearing, so on and so forth, overall health to see how they develop over time from the mothers who chewed the xylitol gum. Just to give that extra layer of safety, which I think is quite admirable. The study seeks to evaluate whether xylitol in pregnancy affects the children's developmental growth, hearing, and vision. The study is important to ensure no long-term harm occurred to the children exposed to xylitol. These results are expected to be in 2027, which again is quite amazing. If you're thinking about a 30% reduction in low birth weight neonates or babies, the outcome looks like, without adding publisher bias, heading towards a positive, how would you say, review. But otherwise, outside of that, you have to give gratitude to the researchers who really have to look at this. This is just something simple. Just chewing 2 pieces of xylitol gum per day, 1 in the morning, 1 towards evening, results in an incredible outcome. Now keep this in mind too. We're not looking at other medications, vitamins, and nutrients, so on and so forth. We're just looking at the intervention of xylitol chewing gum. Again, gratitude to the researchers. I am humble you watch. Look forward to see what you and I both discover next week. Catch y'all next time. See you then. Bye.